What's up? What's up? What's up? I am back with the highly anticipated Basic Skills Lab video. I know. It's been a minute since I posted a video, but y'all, it took a lot to get prepared to go to my lab that was held in Orlando. So my name is Ebony. I know I have gained a lot of new subscribers since I've posted a video in the last month. So I just want to do a brief introduction and thank you so much for being here. My name is Ebony again. I am a student at WGU. I'm going through their pre-licensure. Well, now I am actually in the registered nursing part of the program. And I am a stay-at-home mom to 4 as well as a wife. So although this program may seem a bit challenging, may seem a bit demanding, it fits my lifestyle, as well as a lot of other people I know who are parents or who have full-time jobs and things of that nature. I am making this video to tell you guys about my experience with basic lab skills. As we all know, there are some things that we cannot share, such as what your assessment will be over, and that's highly understandable. Also, each city may be different. You guys may be tested on things that we weren't tested on. So like I said, I did my skills lab in Orlando for 4 days straight, from May 16th to May 19th, 8 a.m. to 4 p.m. And baby, let me tell you, they were prompt every day. They were probably the most prompt and organized group that I've ever been with. I had some amazing classmates and some really, really good instructors. Also, if you stay to the end, I included some key takeaways from the program and things that I could just maybe give you a little bit of advice on before going to your lab. As you can see, I am driving up to the building that our class was held inside of. This is actually a paramedic building, so they have their own classes for EMTs and their own program for those who want to become nurses. They also have a really nice simulation lab, but we will be getting into a new lab, hopefully when I start intermediate labs in October. That's when I'll be back for intermediate labs. As I am getting out of my car, getting my jacket on, you can see right there, I have my meta glasses on. That's actually how I was able to record everything. So make sure you bring your full lab kit. As you know, everything, especially your personal items, are not going to be able to fit in there. So you definitely want to bring a second bag. I have my coach bag right there. Some people brought backpacks or just whatever works best for you. The first day I did not take my lunch. I actually was only 5 minutes away. My hotel was only 5 minutes away, and there were so many restaurants around there that I figured I would just leave for lunch and then come back. That's what I did. Our lunch every day was about 45 minutes, so it gave us time to go get food. As I'm walking through here, I was asking for instructions to where the WGU class was being held. So she let me know that. I walked back, got in there. Once we got seated, we went around introducing ourselves and just telling a little bit about why we chose this program and what we hope to do as a nurse and what inspired us. This was our daily agenda, and it also showed the videos that we were going to cover each of the 3 days. And like I said, they were pretty prompt with everything and made sure that we were good and understood everything. This was a few of my classmates. One of the very nice instructors right there, her name is Felicia. They also took us on a tour of the facility. we got back, we started going through some of our lab kit materials and was drawing up things for injections, and we practiced doing injections for a little bit. At this point, I couldn't record much of anything else, so stay tuned to hear how everything else went. I have completed day 1 of my basic skills lab, and it really wasn't that bad, actually. We did go through a lot of different things, and we watched a lot of the videos. So I did feel like, you know, me watching the videos ahead of time was cool because I was able to answer some of the questions that the instructors were asking. But they literally go through those same videos that they tell us to watch. So I would say prepare, but if you haven't watched all of the videos that's on the list for the things that we are going to cover in the first 3 days, don't beat yourself up about it, because you're going to review the information and you still have time to go over it. I know it's going to be different in each city, but so I know labs are different for each city, but here in Orlando, we actually had like 3 instructors today, and we only had 10 students in our class. Shout out to the student who introduced herself to me, because she is following me on YouTube, and I really appreciate Megan for not being scared to approach me. But anyway, moving on, guys. So we are actually partnered up, and the email that we received had your name and another person's name. Well, actually, it listed everyone's name and the time. It listed everyone's name and the time of your assessment. So the person who was on the same time for me, that's actually my partner in labs. So we are working together on our vitals. They already let us know like the things that we're going to be tested on the last day of the assessment. So that's what we will be practicing more on. And we actually plan on getting together one of these evenings to continue to practice, so that we feel comfortable with each other and getting everything done before the assessment on Monday. Hello y'all. So, or should I be saying Rich Rising, good morning, because it is now day 2 of the labs, and it is almost 7:30 here in Orlando. And I am so tired today because I didn't get much sleep. I brought my husband and children here with me, and my daughter wasn't feeling well last night. So here I am trying to push through until 4 p.m. But I don't have another choice. This is what we have to do, and I'm here to do it. So I will try to show you guys any footage that I can get that's not breaking code of, I don't know, ethics, student code, whatever you want to call it. I know we're going to be working on oral pharyngeal suctioning today, NG tubes, and what else did they say? Also, oxygenation. So we'll be learning about giving oxygen and nebulizers and things of that nature. So stay tuned. I will be back to let you guys know how it went. So we went right into our simulation lab. This is my amazing partner, Angel. She's very smart, very easy to work with, funny, and I just loved her. I was so glad that I was paired with her, especially because I didn't know anybody, but I was glad to have her. So as we were in lab, this is one of our instructors teaching us how to insert an NG tube. I sped it up because I really didn't know how much I could show you guys, but at least you'll know that we are doing our labs on actual mannequins and not each other, because if you read in the handbook, it definitely said that we could not do any invasive things on each other. Thank God. But yeah, so that's Megan right there to the left. And then that's Nora. And we're all just taking our time. They were very, very, very patient with us because, again, a lot of us do not already have medical experience. Okay, y'all, so today is day 4, the last day of labs. And it's about 7:40 a.m. right now. Today is the day that we will take our assessment. And I know that I am going to pass this assessment. I feel like I'm prepared. I feel like everything's going to work out just fine. And I have good faith that God is going to make sure that I walk out of here with a W, okay? So I will be updating you guys at the end of the day. Hopefully it only takes us until about 12 o'clock so that we can get out of here, and so that we all can start to head back home, because I did drive 2 hours to be here. So prayerfully we all just pass and we get out of here and continue through the program, okay? So I will update you guys on my results a little bit later. I realized that I did not make a video about day 3. So day 3, we actually did simulations on the mannequins in 2 different groups. And we were given orders by the doctor, and somebody had to play the role of charge nurse. We had a documentation nurse, which was me. We had an assessment nurse. And so we actually had to go in as if this was a real patient that we were taking care of, complete the assessment, go through everything that you would go through during triage and during admission. And then we received feedback from our instructors. They actually told us that we had one of the best simulation groups for the first time than other groups. So that was kind of like a little pat on the back. And I do feel like what they've told us, shown us, and taught us has prepared us as a student nurse. Of course, we're not gonna know everything, and we barely know anything, but we are working our way through and practicing. We practice so much on the assessment skills, and that's to help us pass the assessment, but also to help prepare us when we are in the field. So I'm kind of excited. I've been a little bit nervous, not as nervous as my peers, but that's because I'm literally getting through this process by faith. Y'all know how I am. So I've just been praying my way through everything, and I'm just ready to continue the journey so that I can move on and graduate and prepare to get my license. That's what this is all about. So I'm excited to see where this career takes me, and where I end up. Okay, y'all, I am back with an update, honey. Let me tell you. First of all, woo, the stress is over. Y'all see, I didn't let my hair down, honey, and it needs a retwist bad. But baby, Orlando done turned me every which way but loose, baby. But I do just want to let you guys know that I passed my lab. Yes, I passed, and now I will be moving on to all the other classes. And now I am going to be good for my clinicals that I'll be doing, as well as intermediate lab in October. So intermediate lab is going to be in the same location that this lab was in. I will say, focus when they give you guys those skills, but don't overdo it. Don't overthink it. Don't get too much in your head. Once you feel pretty confident about the skills, just do it. Just do it. Just go for it. Take your time. Take as much time as you need. They do allow you to correct yourself. I will say that definitely comes in handy because we are students and we are human and we make mistakes. Oh, I need to turn that ear off. So don't get caught up on trying to be perfect. Okay, none of us are perfect. I don't even try to portray to be, and I don't want you guys to do it either. So get in there, learn all that you can, because everything is kind of like being crammed together in a few days. But be confident enough to know that once you grasp the concept of the skill, just do that and you'll be good. So I'm gonna end this video by giving you guys a few key takeaways. Like, if I had to redo it, things that, you know, would have helped along the way, if somebody else would have put it in a video. So the first thing I'm gonna say is practice what to say and how to say it when entering a patient's room, because our instructors were looking for how we verbalize things. You know, if we're being kind, if we are paying attention to what comes out of our mouth, just different things like that. So definitely want to practice. And if you're a shy person or a person who kind of struggles when it comes to speaking in front of an audience, like, start practicing that, because everything we did, we had to do it aloud with our group. And so that would be one thing. To add on to that, we were given a mnemonic called K-Wipes. K-W-I-P-E-S. It literally stands for knock. So you're going to knock on your patient's door. The W stands for wash. You want to always wash your hands or use the alcohol-based hand sanitizer that is there. I stands for introduce. So you want to introduce yourself when you walk in. Like, I would say, hi, my name is Ebony. I'm going to be your registered nurse for this morning, this evening, whatever. And you want to also, before you forget, ask the patient for their name and date of birth. Those are the easiest two identifiers to resort to. And you want to do that immediately. Even though you probably already know their name, maybe you've been in there before or you've seen it in their chart. Do not just say, oh, hey, Mrs. Jones, what's up? Literally, they wanted us to introduce ourselves and ask, you know, so that we could verify our patient right off the bat, because somebody could be in there using somebody else's name, anything. So you just want to make sure that you have them to identify themselves. So KWI. For P, privacy. Shut that door or close that curtain no matter what. Don't forget it. E, expectations. So you'll be letting them know why you're there, maybe talking to them about what the doctor ordered for them, how it's going to help them, different things of that nature. And then the S is for safety. So you want to make sure before you walk out that room that bed is back down to a safe height, which is the lowest level. You want to make sure those bed rails are up. Anything you have to do to make sure that your patient is safe before you walk out of there, make sure you get it done. So again, that was a really good mnemonic that was given to us called K-Wipes. It helped us to get through the process because we had to do it for every simulation. Speaking of simulations, my other key takeaway would be to at least review the patient simulations, the last two that we had that they told us not to complete until lab. If you can, print off the patient reports. I was so glad that I printed off the patient reports because it actually provided the S-bar information along the side when doing patient handoffs. And it was just a really good tool to have to refer back to, because our instructor, when he came in there to give us the information that we needed for each patient, I felt like he was like running it down pretty quickly. But because I already had the report printed out, I was able to share that with my team, and we could all just look over it like that. And I think it was one other person that had her report printed out as well. So that's my key takeaways. Also, start getting in your mind how to draw the medication for the injections. Definitely want to go over that part of your course material. Injections, medication administration. Those are things that you definitely want to review, and just try to relax. Realize that even though you came alone, you're still a team. And if you have good people in your group like I did, we literally work together as a team. Don't be afraid to talk to each other. Don't be afraid to speak up and help your teammate, because ultimately, if you were to work in a hospital or somewhere, when you think about it, you guys really are a team. It's not just you trying to figure out the answer or to figure out what this patient has, kind of wrong with them or whatever. You all are a team. Work together, help each other on those simulations, and just go in there and do your thing. Even if you don't have prior medical experience or a lot of prior medical knowledge, you can do this. You're very well capable, and this program is doable, and we're all in the same boat at this time. Even people who are already LPNs and they are just looking to further their education to become an RN. We are all here together. We're all here to work together. So I would say just remember that. Nobody's better than somebody else. We're all here to learn together, to work together, and to grow as the new generation nurses. So be kind to each other, help each other out, and just go for it. You got this.